So I do regenerative medicine, pain management, anesthesia, because I really have a passion for this. It's in my blood. I enjoy going to conferences, I enjoy teaching, I teach other doctors. Real healing happens with your body using itself to provide. So, for example, if you have a cut and what happens? You heal, right? So people start asking that question, well, why are you healing? Well, the answer is your body's creating products that allow you to heal. So if we could take some of those products that naturally is happening in your body and apply them where you actually have an injury, and that injury is causing you to have pain, that makes perfectly good sense. What is the best product for you? So, there's some patients such as Macy, who was a young person having a lot of pain issues, and she has a remarkable story about how pains affect her life directly and indirectly.
My first injury was when I was in middle school. I tore my ACL meniscus, had surgery for that, did the rehab, came back. Sophomore year of high school, I ended up having to get my disc fusion, just kind of normal wear and tear, I guess, for a gymnast. So I drive a lot for work. I'm consistently in the car or in meetings, so sitting down for longer than 30 minutes made my back ache. And so I would have to pull over, stand out, do stretching, or just walk around for a little bit, just because it was crippling to sit in the car, sit at a desk or at meetings for that long. With surgery, it's kind of just a risk and benefits factor of, okay, do I have time to take off work, going through rehab, doing all of that that comes with surgery, compared to regenerative medicine where I didn't miss a day of work. I was up and at 'em the next day. I immediately felt better.
It's remarkable how science progresses and how we evolve and medicine changes, right? Consider you have a tear in your knee on a tendon or meniscus, and you're having surgery to remove that. Well, wouldn't it make more sense to regenerate that than to remove it through surgery? And that's what makes it really exciting about being a physician, that we're always students.
The science behind the therapy I got, which was A2M, it makes sense that it's highly anti-inflammatory, but I didn't realize how fast I would feel better. Because I was put under anesthesia and coming out of it, I was like, oh, it's just kind of side effects of that, not really thinking much about it, but then it persisted as me feeling better. I was like, wow, okay.
The science is evolving. It's not 100% developed yet, but we're getting there. There's a lot of conferences the doctors are attending to, a lot of case reports. We're keeping statistics ourselves on our patients. And I could not be more excited about being in this field today. I think when I first started practicing, I learned the limitations of what we can do. And it seems like every year goes by, we're getting more and more excitement to it. And we're seeing that happen in our patients.